Hello everyone out there, and thank you for listening to my presentation. My name's Rob McCutcheon and I'm a clinical nurse with the Alcohol and Other Drugs Service working out of the Rockhampton Hospital in Queensland, Australia. It's a pleasure to have the opportunity to share my passion for supporting nurses with you and to share a project that has the potential to speak directly to the lived experiences of regional nurses. So today I'm really excited to share with you my research project titled Call Me Maybe, Do Nurses Feel Confident to Escalate Care? A study that will explore how early career nurses perceive safety, confidence and escalation practices, particularly within the unique context of regional hospital settings. The tagline for this project I think is really simple, but it's powerful as well. It means that this study will be grounded in the real world experiences of early career nurses working on the front lines. Those who are often the first to notice when a patient begins to deteriorate, but who may not always feel confident to act. This work is part of the Research Ready Grant Program, a collaborative initiative between Central Queensland Hospital and Health Service and CQ University as well. It's a project designed to strengthen evidence-based practice and encourage a culture of inquiry and innovation within regional healthcare settings. The project includes clinical and academic collaborators from Rockhampton Hospital and CQ University. As a presenting author of this project, I've worked across several acute settings in Central Queensland, including emergency departments, acute paediatrics and acute mental health as well. So let me begin by unpacking just why this project is so important, not just for nurses, but for the broader healthcare system as well. So timely escalation of care is absolutely critical to patient safety. When a patient begins to deteriorate, that window for intervention can be quite narrow, and the consequences of delay can be really severe. But in practice, we know that early career nurses, especially in regional hospitals, face a range of barriers that can prevent them from escalating their concerns. These barriers include hierarchical dynamics and workplace culture between both their own profession and the multidisciplinary teams that they work in, unclear protocols and limited support as well. In some cases, nurses can often feel hesitant to speak up because they fear being dismissed or undermined. This issue is particularly relevant in regional settings like Rockhampton Hospital, where access to tertiary services is limited and nurses often work in high pressure situations with fewer resources than their metropolitan counterparts. In these contexts, the stakes are high and the margin for error is slim. Our study also aligns with the National Safety and Quality Health Service Standard 8, which focuses on recognising and responding to acute deterioration. By understanding the challenges that nurses face in meeting this standard, we can identify opportunities to improve systems, enhance training, and ultimately safeguard patient outcomes. So our overarching aim for this study is to explore how early career nurses perceive safety, confidence, and escalation practices in regional healthcare, with a particular focus on Rockhampton Hospital. In order to achieve this aim, we've developed three key objectives. The first is to identify the factors that influence escalation behaviour. This includes things like examining how education, clinical experience and workplace culture shapes nurses' decisions to escalate care. We want to understand what gives nurses the confidence to act, but we also want to understand what holds them back. The second is to assess how clinical experience correlates with confidence in escalation. We're interested in whether increased exposure to acute care scenarios builds confidence, or whether other factors like mentorship and team dynamics play a more significant role. The third is to uncover both the barriers and the enablers that shape escalation practices. This involves not only identifying what gets in the way, but also what helps, whether it's supportive leadership, clear protocols, or peer encouragement. So this research is strategically aligned with CQHHS and CQ University's priorities around regional workforce development and improving clinical safety as well. So how will all this research be conducted? To answer these questions and objectives, we're using a mixed method convergent design, combining both quantitative and qualitative approaches. On the quantitative side, we're using the CARED scale. The CARED scale is a validated 22-item survey that measures clinicians' attitudes towards responding to and escalating care for deteriorating patients. This will be distributed to registered nurses from acute and subacute wards that use medical emergency teams or a variation of for escalation of clinical concerns in the Rockhampton Hospital. On the qualitative side, we're conducting semi-structured interviews with early career nurses. These interviews will explore their perceptions of safety, their experiences with escalation, and the contextual factors that influence their decisions as well. We'll be using Braun and Clark's thematic analysis to identify patterns and themes within the data. Recruitment for this project will be multi-pronged. We'll be using posters, QR codes, service-wide emails, in-service sessions on wards, and also graduate days to reach as many participants as possible. We're also implementing a champion model, engaging educators, nurse unit managers, clinical nurse consultants, anybody within that realm of nursing leadership to help promote the study. And to thank our interview participants, we'll be offering a certain amount of wellness packs to the value of $50, which will be a small gesture to acknowledge their time and their insights. Ethical approval for the project will be obtained through CQ University and CQHHS Human Research Ethics Committees, and will ensure informed consent and confidentiality throughout the conduction of the survey and interviews through de-identification and strategic gathering of demographic data. The data will be anonymised and stored securely in line with university and hospital guidelines. While our timeline is still being finalised, it includes phases for ethics, recruitment, data collection, and analysis. We're working closely with stakeholders to ensure a smooth execution and timely reporting. So what do we hope to achieve through all of this research? We expect to uncover a range of barriers and enablers to escalation, from systemic issues such as unclear protocols to interpersonal dynamics like team culture and mentorship. Firstly, we want to improve clinical education and support for early career nurses. By understanding their experiences, we can better design training programs and mentorship programs to support them. Secondly, we aim to enhance patient safety by promoting confident and timely escalation processes. Our anticipated outputs include things like academic presentations and peer-reviewed publications, policy recommendations for regional health services, and also some practical tools for nurse educators and managers to be able to support their early career nurses. So looking ahead, we really hope to expand this research across regional hospitals in the state and continue exploring how better to support nurses in escalation protocols. Ultimately, our goal is to contribute to a safer, more responsive healthcare system, one where every nurse feels confident enough to speak up when it matters the most. So, in closing, I wanted to thank all of you for taking the time to engage with my presentation. I hope that it's offered some really valuable insights into the challenges and the opportunities surrounded by escalation practices among early career nurses in regional healthcare settings. To me, this research is more than just the data. It's about the real experiences of real nurses that show up every day to work, often under pressure, and make those critical decisions that impact a lot of people's lives. By listening to their voices and understanding their barriers, we can build safer, more supportive systems that empower nurses to act with confidence when it matters the most. As we move forward, I invite all of you to reflect on how we can each contribute to a culture of safety, advocacy, and continuous learning, whether that's through education, mentorship, or policy change. Because at the heart of every escalation, there is a simple truth. Somewhere, someone cared enough to speak up. So let's keep creating spaces where that courage is not only welcomed, but it's celebrated. Thanks again, and take care.